it's me, Jen again, and now Thyroid RFA has made its way to the fourth largest city in the US. We'll hear from Dr. Cristina Boccalandro after this. If you value this content, then please subscribe to this channel because that helps YouTube put this content in front of more people, and that helps more people to learn that they can save their thyroid from surgery through minimally invasive procedures that directly target and shrink thyroid nodules while preserving the thyroid gland itself. Today's guest began her medical career in the Amazon jungle. Fast forward to today, and she's providing cutting-edge treatments for thyroid nodules in Houston, Texas. Let's hear more from Dr. Boccalandro about how she's treating thyroid nodules with this procedure called Thyroid RFA. I was reading about you, and I saw that you had some time that you spent as a jungle doctor. That is incredibly interesting. Can you just real quick tell me about when you were doing that? I'm assuming you didn't have like any technology that you were able to use down there like ultrasound. So did you see a lot of visibly noticeable nodules in those people?
Not really, no. I think it was such an incredible experience, and I think I was so lucky to be able to do it. So, I'm from Venezuela, so I went to medical school there. And when we graduate from medical school, we have to do social service. So we have to give a year back. And so I decided instead of working in a shanty town, which was what I would have gone, and would have been dangerous, I thought, well, I really like to explore. And, you might have read, I also like photography a lot. And I did like it even back then. So I said, okay, jungle it is. I actually went first as a medical student, like my last year of medical school. You're allowed to do like a mini social service. It's a 3-month. This is a really, really, really remote place. Close to the border with Brazil is where we have our Amazon jungle. Me and another student, we just showed up to the doctors that were finishing their year there. It was just an adventure even to get there. There are no commercial flight. You have to wait for a ride, for a plane, basically. So my ride, the first time I arrived there was a DC-3. I don't know if you've ever seen those planes, like 1930s planes, this huge plane. So this plane was just a cargo plane, and just the pilot gave us a ride. So I just was sitting in a box of dried meat, and that's how I got there. The group we work with are called Yanomamis, and so they are like very famous anthropologically because they're very remote. So they're really hunter-gatherers. They don't even have a calendar. They don't count. They don't know the metal. I mean, they're just like Neolithic. You are the weird person there. I did my 3 months, and then I came back as a doctor, the following year. So overall was about a year there. That was an amazing experience.
Thank you for that tidbit about you. It makes you very interesting. And so from one end of the spectrum to the other, now we've got this amazing technology, RFA, and we're able to zap nodules and keep the thyroid intact. And I'm excited that it's getting so much more common. When did you start offering this in your practice? Do you have anything else in your practice that you're doing like PEI or anything like that to help patients with their thyroid nodules?
Yes, I was always interested in thyroid since I started my fellowship, which most of my medical school was in Venezuela, but my formal postgraduate training, residency, and fellowship was here in Houston, University of Texas. And then 20 years ago, it wasn't that easy to learn how to do ultrasounds and biopsies, believe it or not. But I always wanted to. So I managed to learn, which was not easy. So I think it's just been a progression, right? I mean, yes, I do PIs, I do biopsies. I mean, for me, ultrasound is like my way to do a physical exam. My thyroid patients, at least once, when I first meet them, we do an ultrasound just because it really helps me a lot to understand what we're talking about. For example, sometimes you have patients that, I'm sure you have heard that story a trillion times, that, have normal thyroid levels and they feel bad and the antibodies are positive and then nobody wants to listen to them. And then at least doing an ultrasound really helps me because then you see a thyroid that it's a bomb, right? So you understand that there's something going on. I mean, I was so excited when we had molecular testing, right? We could do molecular testing on thyroid nodules, and that always has been a dream. So now it's possible, so we do it. A couple years ago, I went to one of our endocrine meetings and I learned about the technology. I was like, wow, I want to learn how to do that. We ended up in Brazil. That's where we went to learn. At the time, there was not really too many opportunity to learn how to do it here. So we went with Dr. Rangel to Rio and spent some time there, did some cases. And then the pandemic hit. I did wait it. I did not feel like I wanted to start something new in the middle of COVID. When things started opening up, which was towards the end of last year, I did purchase my equipment. Our first case was around March of this year. I have done so far 9 patients. Every patient gets easier. I find that I'm faster, I feel confident doing it. So far, I have patients that already have 3, almost 6 months follow-up, and all of them have done really well. And follow-up, which is usually, we do ultrasound a month, 3 months, and 6 months. Even at a month, sometimes I've seen up to 50% decrease in the size of nodules. And sometimes if the nodule is really big, which, occasionally it is big, we don't see quite much as 50%, but all of them have, which is really encouraging, have relief of their symptoms. So they all say, I swallow better, I don't feel as much pressure on the neck, which, is usually very annoying. They feel well following tagging those patients along, but so far so good. And we have quite a few in the pipelines, and most have been my patients that, they were waiting for the RFA, but now I'm starting to get a lot of patients that, are knocking at the door from new places. So,
well, I would expect that because, you're the first in Houston to offer this.
That's correct.
And Houston is the 4th largest city in the U.S.
It is.
So
yeah, it is.
That's a really big deal.
Yes.
It's the largest city in the South. Do you think that at some point down the road, once you've been doing this longer, that you might be hosting some physicians to come and observe? Has anyone asked you to do that yet?
Not yet, but I definitely would, because that was my hurdle when I started this, and there was nobody that could come and help you. Dr. Hans did. We went together to Brazil to do the training, and so she got started before she worked through all the pandemia. So when I was ready to do my first case, I did reach out to her, and she actually came to Houston to help me make sure that everything was done correctly and set up correctly, and, kind of refresh the process. And so I think that was really instrumental. I don't think a procedure like this, you should do it without somebody kind of being your mentor and helping you. She is super experienced and she has done thyroid for many years, so have I. So, maybe we can be a little bit more independent, but certainly not everybody has that experience. If you want new doctors to learn, then I think definitely you need people to teach you.
Absolutely. And I think Dr. Hans is fantastic. I think it's great that she's doing that. Are you aware of this new organization, the North American Society of Interventional Endocrinologists?
Yes, I just love the name Interventional and Endocrinology, because it's awesome.
They're doing a lot of support for physicians. I've been able to watch a couple of their webinars, and I think it's really neat that they're trying to foster the interventional endocrinology idea, that it's not just for interventional radiologists, it's an endocrine procedure too. So what do you think about the laser? This new code has come out for the laser ablation procedure. I think it's interesting that we have a code for it now, considering that RFA's been on the scene longer. I'm hoping that we'll get a billing code for RFA soon, because I think that's one of the biggest barriers for patients, is that a lot of insurances don't cover it. Anytime I do one of these interviews, I'll post in our Facebook group, do you have any questions for the doctor? Sure. And 9 times out of 10, someone will say, what about insurance? Do they accept insurance? And I know that a lot of physicians just do self-pay. Is that what you do, as a self-pay option?
Yes, we have tried several times. Some patients have requested that we send a request for approval to insurance, and we have, but they simply they don't have any way to cover it. Now, sometimes patients do get reimbursement. And the other thing is, at the end, it doesn't seem to be as painful, because most people can apply it to their deductible anyway.
Right. If you have a really high deductible, then that is kind of helpful in that regard.
Most people do. I think it's rare to see somebody who has a super low deductible these days. So it's usually in the thousands. So, you kind of use it for that a little bit. At the end, it's not a complete wash, which is good.
So my goal right now, we run the Facebook group for patients, and it's up to 2,500 plus people. And what I really want us to do is convert that group into a nonprofit organization. And one of the biggest goals that we have for that organization is to really work to try to get insurance to cover this procedure. We have several goals in mind, and you know, the main thing we want to do is just help prevent unnecessary thyroidectomies through education, through providing resources. You know, sometimes surgery is necessary. I mean, you know that from your experience as a surgeon, I'm sure.
Yes.
But there are many cases today now that we have these alternatives that the thyroid could be saved. So that's what our goal is to help those patients find the procedure, find the providers, and get the information that they need.
Yes, and to me, it's, you know, immensely satisfying to be able to offer something different because, you know, up until recently, it's always the same conversation. Well, what can we do with that nodule? I'm like, well, we only can do surgery. And I mean, maybe we can just take half of the thyroid out and we can leave the other half and, you know, go from there. And luckily, you know, I think I'm very privileged because, you know, I am in the Texas Medical Center, which is literally the biggest medical center in the whole world. I mean, this is a whole city. And I have 3 endocrine surgeons, 3 just within like a block. And then, you know, we have MD Anderson, we have, you know, head and neck. I mean, we can do any kind of complicated surgery, and I can do thyroid surgery without complications. I mean, my patients have no complications, but that is not the case in most, you know, places. You don't have surgeons, and then you get to see those patients that come back and don't have a voice, or, you know, their calcium is low because they require thyroids, and, you know, you'll be doomed for life. I mean, forget about having to take thyroid hormone. I mean, it's, you know, just other things that will keep going on. And most thyroid surgeries are not done by endocrine surgeons or by thyroid specialists. Most thyroid surgeries are done by general surgeons. Because they're just, and probably there's not enough people, like you say, saving thyroids, right? Sometimes the point of entry for a patient is an ENT, for example. I had that experience many times. And because it's a surgeon, they don't even biopsy the patient. They just send the patient to surgery. And I'm like, what? I mean, how do you know you even have to take that nodule out? I mean, if it's a benign nodule and there's no compression and you're positive, you're following that nodule with ultrasound, well, I mean, just leave the nodule. Why are you going to take it out?
That seems excessive.
Yeah, but surgeons are surgeons, and they just, you know, out and done. And sometimes if you do a surgery without a biopsy prior, then you might find out that, you know, you took half of the thyroid out, you close the patient, and then the surgical pathology comes back malignant, right? So guess what? Then you have to go back and take the other half out. Having a good thyroid surgery plan ahead it's important. So if you need to do surgery, we'll just do one surgery, right? You don't have to go back 3 times to, realize you forgot something. And also, I see older patients that probably have nodules that they have had their whole life. Particularly conservative when I get to my older patients, you know, and I think sometimes doctors create a lot of anxiety on a patient when they say, well, you have a thyroid nodule and you have to have surgery. And so they send them to me, and I get this 85-year-old patient with a lot of health issues with, a thyroid nodule, but don't bother the patient, the thyroid nodule. I say, well, you know, let's just wait, you know. I mean, why am I going to be biopsying an 85-year-old person and create anxiety and problems? So I think everything has a time, a moment to do things. And I think we should not create anxiety unnecessarily in patients. And I see, you know, in general, that's a problem. People come very anxious and very worried about the nodules. And, you know, most of the thyroid nodules are benign, which is a blessing. And I'm not saying thyroid cancer is not important and we should diagnose it and treat it appropriately, but tends to be, thankfully, in most cases, a rather benign disease. So we should try to be more conservative, and, you know, it is important to have a thyroid. It definitely makes your life a lot easier.
Oh, yes. The anxiety you mentioned, that's one of the biggest things that I see with patients who've just been diagnosed with nodules, is that they're just incredibly worried that this is going to kill them. They're so unaware. I don't think they're being properly educated about how benign nodules are so common and so not harmful. And so they're just terrified. And that's one of the reasons we want to do this nonprofit is just to put that information out there for the masses to see that it's not a scary thing. You know, I compare it a lot of times to unwanted body hair. You know, it's something
Yes.
you'd rather not have, but it's probably not going to kill you. You know,
Yes.
it's just annoying more than anything. And I have a nodule that I don't know if you know my story. I had this really big nodule on the right side that I had treated, and it shrunk 90%. I'm doing so much better since I have my treatments, but I have one on this side. I don't even know it's there. It's like 1 centimeter. I can't feel it. I have no idea where it is. The only reason I know it even exists is because I've had ultrasounds.
Yes.
If I didn't know what I know about nodules and that came up incidentally, I wouldn't know, oh, this isn't harming me, you know, unless my
Yes.
doctor told me. And I think that that's what's happening, is that
Absolutely.
they're just not being informed. And so we want patients to be informed about the statistics on nodules, the statistics on thyroid cancer, and then the options besides surgery, and just to be able to educate themselves and then advocate for themselves and make the best possible decision for themselves.
Absolutely.
Rather than unnecessarily having a surgery that is going, as you said, it's going to affect the rest of their life.
It really is going to. I think we can almost always make a patient have a normal life after a thyroidectomy, but why doing it if you don't need it, right? That's my point. We have to, and we'll work with the patient to make sure we get things adjusted. But I think we should not be doing unnecessary surgeries. That's for sure. 100%.
Well, that is so refreshing to hear. My favorite things about interviewing doctors that do RFA is to hear doctors say that, because so many patients, myself included, have gone to their local doctors and been told, oh, no, RFA is bad. You just need to have surgery, and it's no big deal. Just take this little pill and you'll be fine. And so to be validated by a medical professional after you've been invalidated for, all the time prior, it's wonderful.
I think, other doctors have not seen an RFA, right? And have not seen how effective it is and how, relatively easy on, of course, experienced hands he is. And the patient is completely comfortable during the procedure. I think talking to Dr. Hans and other people that are doing RFAs, we all surprise ourselves during the procedure, because you're talking to the patient is awake, you're checking the voice to make sure everything is good during the procedure, and they're just chit-chatting with you, and you're like burning that nodule, and you're like, are you okay? You're fine. Yeah. Anything hurting? No. And you're like, wow, this is just so amazing. It's really something with very minor discomfort for the patient. It takes an hour to do the procedure. I always talk to the patient the day off and the day after. Okay, there's a little discomfort and a little bit of pain after, but everybody's up and around, and just maybe a little ice the afternoon of the procedure. The next day, I call them and they're out eating at a restaurant. I'm like, okay, that's really cool. They're just doing their normal lives. Worth it. It's worth it. Let's say worst case scenario, you had a big nodule and you couldn't decrease it 90%, but a huge nodule, if you do 50%, you probably don't feel it anymore, and if there's a need to repeat a second RFA on very specific cases, you actually can repeat a second RFA. So it's not something like you do once and done. You can always do it again if you need. And I have patients that I've already done, they want to do both sides. They're coming for the second side and they just don't want surgery. So, and that's okay. We can do more than one. I do have patients that have come from out of town and they want to have the follow-up ultrasounds locally. And I have said, I don't think it's a good idea, because really the nodule looks so different after you do the RFA that if somebody's not accustomed to that, it almost looks like a thyroid cancer on occasion, because the nodule looks really irregular and looks really dark, and so completely changes after it's basically scar tissue. That's important to, come back to your endocrinologists that have done your RFA for follow-up. The medical community needs some education.
I hope that that's coming, with the ATA now providing some information about RFA to their members.
I'm glad you're doing this great work. It's a lot of work to do what you do, and shows you're just trying to help out a lot of people, and that's great.
Thank you. I'm very passionate about it because it's my personal experience. I wouldn't have chose to go down this road for sure. But now looking back, I'm so glad that that's how it worked out, because I am very passionate about wanting patients to know what their options are because so many of them don't.
Agreed. I think there's a lot of misinformation too. Finding good, accurate information, it's hard. I think
Yes.
sometimes harder than finding information because you just don't know what to believe, right?
So that's a good point you bring up. So it's very common in our group for a patient to say, I went to my physician and I asked about RFA, and this physician is not trained in RFA, and this physician immediately says, no, RFA is bad. RFA will cause more problems than it solves. Have surgery. And I can't tell you how many times I have to say, I'm sorry, but that's not true. You know, you can read scads of medical papers that say that's
Yes,
not true. It's not
absolutely.
just my opinion.
I think that's the beauty of my work, at least. I mean, I can speak for myself. This is instant gratification, right? So
Right.
when you can help somebody, you feel instantly happier. And you know, most of the time, if you see them, they're feeling better, or you have solved the problem. Okay, they made your day, and that's it. You feel that you're doing something worthwhile.
If you have other interviews you'd like to see or want me to interview you, leave it in the comments below. And if you're looking for support from a community centered around the topic of thyroid nodule treatments, please join our Facebook group, Thyroid RFA and PEI Testimonials. The link is in the description below. Thank you so much for watching. You can help others tremendously by sharing this content. Never forget to educate yourself and be your own health advocate. Now, watch this next video right here.